Hello, we're in the Nick Antic Sleep Laboratory and I'm Sutapa Mukherjee. I'm an Associate Professor at Flinders University and a sleep physician. And I'm here with Professor Danny Eckert, who is Director of the Adelaide Institute for Sleep Health. And we're here to talk about sleep apnea, a really important topic. So first up, we've got some yes-no questions, which I'm going to ask Danny. They're yes, no, maybe answers. So the first question is, do all people with sleep apnea snore?
Mostly. Breaking the rule already.
All right. The next one is CPAP or continuous positive airways pressure therapy the only thing that will help sleep apnea?
No.
Okay. The next question is obstructive sleep apnea the only form of sleep apnea?
No.
Okay, so I've got one more question is, do only overweight people get sleep apnea?
That's a no as well.
Okay, so hopefully that's piqued your interest a little bit. And now we're going to get into a bit more detail about sleep apnea. So how common is sleep apnea?
Pretty common. The estimates indicate nearly 1 billion people around the planet stop breathing, at least 5 times or more per hour. And these stoppages in breathing last for at least 10 seconds at a time, disrupt your sleep, lower your oxygen levels, and can leave you feeling pretty rotten the next day.
And so do all those 1 billion people around the world, do they know they've got sleep apnea?
Look, it's hard to get an accurate estimate of just how many people know, but the current estimates are, at least 80% of those people do not know they've got it. Now, sleep apnea is not always something that you necessarily need to treat, which you can talk about, and the different types of treatments, but this is a very common chronic health condition that's affecting a huge proportion of the population. And as you indicated with the yes or no questions, it's not just overweight, middle-aged men that have got this disorder. Study we did a few years ago now showed that half the people that came through the clinical service for a diagnosis of sleep apnea were in fact not obese. So the causes of sleep apnea for those people are actually quite different to the people that are overweight, and as are the optimal therapies.
Okay, well, we'll get into the therapies a bit later, but what are the normal symptoms that people might have if they've got sleep apnea?
Well, yeah, and maybe you want to talk about this bit. I mean, with the patients that come and see you, we hear about these common issues of being sleepy, perhaps some brain fog in the morning, some headaches. There might have been some near-miss incidents on the road. We talked about snoring, and yes, absolutely, the vast majority of people with obstructive sleep apnea, that's where the airway's actually closing off again and again throughout the night, do indeed snore, and often quite loudly. Sometimes they don't, but they're the range of sort of symptoms and things that might suggest. But what's your experience in the clinic?
So all sorts of things. So definitely snoring, tiredness, fatigue. Sometimes, people are falling asleep. As you say, driving, or they get home from work and they fall asleep for a few hours. Sometimes it's even getting up to go to the bathroom a lot overnight can be one of the only symptoms. Every hour they might have to get up, go to the bathroom.
And why is that? Because sometimes, particularly as men age, they might be thinking, gosh, this is all to do with my prostate, or why are they getting up all the night throughout the night with sleep apnea?
It definitely seems to be related to the fact that they've got obstructive sleep apnea, where the airway is closing off during sleep, and then the body's response to the fact that they're not breathing is to actually cause them to wake up. And I have seen, a number of patients who you put them onto treatment and they come back and they say, I'm not waking up as much anymore. I'm not having to go to the toilet several times a night. So there's definitely a key link.
Got it. So it's the fact that they're waking up throughout the night. It's not that they need to go to the toilet as such. It's just they're awake, so they go to the toilet because that's okay.
That's right. I mean, reflux at night. So some people wake up with indigestion, that can be related to the sleep apnea.
Yeah. And so if you don't have a bed partner, how do you know if you've got it? I mean, because, snoring, and they might witness you stopping breathing. What are some of the other reasons that people come and see you if, that I guess it are those other things, but how do they get there?
So sometimes it's actually because they have gone away with someone and they happen to be sharing a bedroom when they don't normally have a bed partner. So often it's on holidays, and then they'll come back and say, oh, my sister or my family member or my friend said that I was snoring and that I was actually stopping breathing. So sometimes it's just the fact that they've got somebody who's observed them that lets them know. But if you don't have a bed partner, it can be feeling really tired, waking up a lot at night, sleepiness, irritability, falling asleep in different situations that you wouldn't normally. So it's kind of more indirect measures that something's not quite right with your nighttime sleep.
Yeah, interesting. And I guess one of the big things that we do here at the Adelaide Institute for Sleep Health is figuring out why people get their sleep apnea. What causes this very common chronic health condition? We've already outlined that it's not just related to obesity and being overweight, although that is a major risk factor. And so we now know that, things like the shape and size of your jaw and your airway muscles is an important factor, and these things beyond your sort of physical anatomy. So whether your muscles can actually work at night to keep that airway open, how deeply you sleep. So if you're a bit of a light sleeper, that can be a cause of sleep apnea, and that light sleep can contribute to the cycle of obstructive sleep apnea. And some people are just too sensitive to carbon dioxide, which is the main driver of breathing during sleep. So there's the sort of three non-anatomical reasons in addition to these sort of anatomical or skeletal factors that can cause sleep apnea. So very different causes for different people. And, as we've learned more about that, that's really opened up the opportunities for different treatments. So we're now developing treatments for each of those different targets. So, maybe just tell us a little bit about CPAP, because I know that's the first one that people are often start with, particularly if it's moderate or severe. But and then perhaps we can talk about some of the other things that are coming online.
Yeah, sure. So CPAP's been around for almost 50 years actually, and that's continuous positive airways pressure. That's administered with a mask, so it can be a mask that covers the nose and mouth or just the nose, and it applies positive pressure to the airway to keep the airway open. So it's a very physical treatment to keep that airway open so that the airway doesn't collapse. And it's very good for all severities of sleep apnea. But there are other therapies that we do use routinely. And so obviously weight loss can be a good therapy if you're overweight. And we know that if you lose 10% of your body weight, there will be a 30% improvement in the severity of your sleep apnea. So a disproportionate improvement. But that is if you're overweight, and not everybody is overweight. Mandibular advancement splint, so like a mouth guard that pulls your lower jaw forward, is also very good at treating sleep apnea, usually the mild or moderate severities, but you and I, we have looked after people who even in the severe category can improve quite significantly with mandibular advancement. And making sure you're not on your back is another really important one, because we know that sleep apnea is, particularly obstructive sleep apnea, is worse when you sleep on your back. So postural change can have a really big impact. Surgery is another one. Not always done very commonly, but in select individuals can have a very good result. So, they're just a few of the standard therapies that we're aware of, but there's others that you and I are both involved with research studies wise to try to really increase the variety of therapies that we have for people with sleep apnea, different medications. I think you've already mentioned some of those. And, we're always looking for new therapies that we could use for sleep apnea.
Yeah, and one of the really exciting things that we've been working on here is actually combining different therapies, isn't it? We talked about because CPAP is not for everyone, and one of those causes we talked about, the light sleepers, or what we call a low arousal threshold, those folks tend not to do so well on CPAP. They can't physically tolerate it, and so some solutions we've been looking at for those folks are things like, the mandibular advancement splint fitted by a dentist, and also if they've got severe sleep apnea, they might need a device to help them not sleep on their back, and put those together, and it does just as good a job for many as the CPAP. So that's one option. We're looking at some drugs for weight loss. There are these new drugs that are coming out, and for diabetes and things, we're looking at the impact of these drugs in our clinical trials to try and medically reduce weight to yield those benefits for those. But yes, there's really a lot of different options that are becoming available as we've highlighted. So exciting time, lots of hope out there for new avenues for therapy. And that's what keeps us going each and every day. So why don't we finish off and perhaps just share some insights about things that we do to optimise our sleep each night.
All right, so one of the things that I do is I'm actually very careful about how much caffeine that I have during the day. Just as a little one.
It's morning, folks, don't worry.
and part of that is that, caffeine is one of those chemicals that can actually disrupt sleep. So, being careful about how much caffeine I'm having during the day will help me to get off to sleep when I want to be asleep.
Yeah, good one. And for me, I guess while we're on the food and drink, I've certainly learnt to stay away from big, heavy meals, just prior to sleep, because, it can lead to reflux and discomfort and just make you feel a bit uncomfortable and have a disrupted sleep. So usually wait at least a couple of hours and after meal time before going off to sleep. Good.
Well, thank you, and hopefully you've learned something new about sleep apnea.
Thank you so much. Sleep well.